Hi, my name is Lynn Halloran, and I've been practicing pharmacy in Minnesota for about 22 years. I had a business degree out of college, and after working a few years in marketing, my passion for helping others really brought me back to the healthcare field. And at that time, I chose to focus on pharmacy because I thought it would be a good matchup with my business degree and skills. I worked in different pharmacy settings, starting in hospital, then clinic, and then a small retail pharmacy that I worked for over 11 years. I realized after a few years in that helping people and counseling was what satisfies me as a pharmacist. I loved working in the community that I lived in, watching families grow and helping those as they aged. That really fulfilled me as a pharmacist. But all that changed after the independent pharmacy closed. Knowing all those customers for 11 years was hard to lose, and at my next retail site, it felt totally different. I didn't have those relationships that had meant so much. In addition, the focus of pharmacy was changing over the years to a more insurance-driven healthcare model. I began seeking something different, a more integrative approach to healthcare. As more and more drugs came on the market and patient costs rising, pharmacy just started getting frustrating with prior auths, and everything was driven by the insurance. So I started going to continuing education seminars with a chiropractor friend, and I was blown away by the preventative integrative approach to treatment and patient care. This really started the change of my focus. This was probably about 10 years ago. This led me to looking at more prevention of disease. The more I learned, the more I realized that nutrition is such a huge part of one's health. And I proceeded to get a certification as a nutrition therapy practitioner. I graduated from that program in 2015. Learning how whole food can affect, prevent, and improve health, my passion for education and patient interaction came back, but in a new way. I loved meeting with other healthcare providers that brought an integrative or functional medicine approach. I saw how key it was not to just counsel a patient on their medication, but incorporate teaching and empowering them to take control of their own health. So I started incorporating this approach to my pharmacy counseling. Time challenges make it really hard to spend a lot of time with counseling and educating patients in the pharmacy. I try as best as I can to educate patients and steer them to be able to make choices and be active in their health. In the pharmacy, I feel I have many health coaching moments. Spending a few extra minutes can go a long way. For example, adding in a probiotic to an antibiotic regimen and teaching the patient why a probiotic is an important role, not only during their course of antibiotic treatment, but after, can really improve my health. That, I think, goes a long way with the patient. Another easy example to educate and empower at the pharmacy is in the cough and cold section. How many products are there on the market, right? It's really confusing. And how many products really are there for treatment? Well, there's 4 as I see it. So you have a decongestant, an antihistamine, an expectorant, and a cough suppressant. But when a customer looks at all the different products and combinations on the market, it's really confusing. So it can be really streamlined, and by asking the patient their symptoms, you briefly explaining the differences of the products and see what they have at home. And after doing this, I can help them make a choice, but I also slowly build in home remedies if they're accepting of it. Water with lemon, honey, apple cider vinegar. There's lots of different ways to help them out and to have them make the decision. And most patients are very appreciative and actually will seek me out at future encounters when they have questions. And also the pharmacy employees at my pharmacy know that I have this passion and knowledge of nutrition and supplements, and they actually seek me out to help customers when they have questions. So that is really rewarding as well when I'm in the pharmacy. When I work in the pharmacy just part-time, and besides doing that, I now have my own private coaching and nutrition business where I coach patients individually and I teach classes. And I love this because I can definitely go steps farther helping with their care than just the few minutes in the pharmacy. Health coaching is a powerful approach to working with a client. It is very rewarding to make those connections, having the time to truly listen to what is happening in the patient or person's healthcare journey. To watch someone make changes in their lifestyle or diet modification that impacts their health is truly amazing. So much of promoting and helping the patient or client have awareness and control of their health is what makes it so special. Sometimes their doctors are even amazed at what they have done to reverse their conditions naturally with nutrition, and sometimes including supplements. As their coach, I spend time in an initial appointment listening, going over a questionnaire of symptoms, a client interview, which includes their history, and a food journal of at least 3 days. This really sheds light on how they eat and is especially eye-opening to them. It also holds an accountability factor as they continue with the coaching relationship. The biggest thing I notice in this session is how much the client appreciates being heard and just being listened to for more than 15 minutes and actually express what they really want in their health care. And that goes a long way. Usually they come to me after several appointments or years of not feeling well. Together we make a plan that is doable. It can be as easy as drinking more water, especially maybe putting some lemon in it before they eat a meal to help with digestive juices and getting those stimulated. I give them handouts to take home and work alongside them at their pace. I give them supplements only when needed, or we incorporate what they want to take, but we also look at other things in their life. How is their stress? How is their daily schedule? And so it really incorporates them as a whole versus just at the pharmacy when you're quickly counseling them about their medication. And I think that has been really a rewarding piece for me. But my number one requirement for them when they come to see me as a nutritional coach or counselor is that they have to be willing to make a change, because that is important. If they're not ready to make a change, then changes won't happen. The nutrition class that I teach is a 5-week class, although I will do it one-on-one in a group setting is really encouraging because you have those others who can help hold the person accountable. This class focuses on education with a 3-week period of a sugar detox included. So the group support, which is awesome, is a big factor. I go over preparation, digestion, blood sugar, healthy fats, and reintroduction of foods after they have had the detox. To see the transformation in everyone is truly a gift to myself as well as the individual, because most people do see a big improvement, not just weight, but they actually feel better. I feel nutrition plays a fundamental role in one's health. Many times it is the root cause of an issue, and improving how one eats and teaching them why enables them to take control of their health. That seems to be a reoccurring theme here, but I really feel that empowering someone and having them take control of their health is worth a lifetime of health for them. As environmental toxins, pesticides, quality of the soil, and food all affect our bodies in different ways, I feel as both a nutritionist and a pharmacist, it is important to learn and understand how the choice and environment each patient makes an impact on their body and their health. Bio-individual assessment is a key, as everyone's nutritional needs are different, but educating on just the nutrition basics, eating good quality fats, proteins, healthy carbs, drinking lots of water, teaching about digestion health, what actually happens when you digest your food, blood sugar or insulin, why so many people are pre-diabetic or getting diabetes early in life, really lays a foundation of education. We live in a world that our bodies always seem to be in fight or flight mode, constantly in stress, and having the time to counsel on both physical and emotional stress all play a role into our health. And so physical and emotional stress too is also a big healing component, and I think health coaching really allows you to dig deeper into that as well. Taking the time to sit with a client and review their food journal and lifestyle questionnaire is also key to helpful to have them see how they can make an impact on their health journey too. This is lifestyle medicine at its core, helping individuals and families make changes to sustain healthy behaviors that will affect their health and quality of life. Here's a quote that I love, as Hippocrates said, "Let food be thy medicine and medicine be thy food." Having the knowledge and mindfulness in coaching and walking alongside a patient, even if it's just a one-time encounter, can change how they see their role. It is important to be non-judgmental as you listen and guide. People want someone to listen, and they want to be heard. Many patients are looking beyond a quick fix these days, and as disease becomes deeper and autoimmunity is becoming a larger part of the population, I really feel there is healing. People don't just have to take a diagnosis and be stuck with it. There's really healing and reversal that can occur, but it takes time and it takes dedication, and it takes empowering the patient to be able to do that themselves. So whether the patients are counseled in the pharmacy or coached privately, we can make an impact. So I recommend to you is that you find what you are passionate about and you incorporate that into your profession. That will make you a healthier and happy person, a healthier, happy pharmacist, and eventually maybe someday a health coach too. Thank you for listening, and I am always here if you have any questions or want to talk about nutrition. Have a great day.